Proposition 61, State Prescription Drug Purchases, Pricing Standards, Initiative Statute. Plain language, place limits on the amount that California healthcare agencies pay for prescription drugs. What does it do? In any medical program where the state agency is the ultimate payer for a prescription drug, Prop 61 would prohibit state agencies from paying any more for a prescription drug than the lowest price paid for the same drug by the U.S. Department of Veterans Affairs. Excluded are purchases of prescription drugs under managed care programs funded through Medi-Cal. The state pays for prescription drugs under many different state programs, including Medi-Cal, state employee healthcare, and even prison inmates. In 2014 through 2015, the state spent almost $3.8 billion on prescription drugs. State funds pay for roughly half of the prescription drug spending, and the rest is paid with federal and other non-state revenue. Prescription drug pricing. Like most products, prescription drug prices are often negotiated by different purchasers. So various purchasers, including government agencies, may be paying different prices for the same drug depending on the deal they made with a drug company. In some cases, purchasers sign confidentiality agreements for some discounts. The United States Department of Veterans Affairs, or the VA, provides comprehensive health care to approximately 9 million vets. The federal government requires drug companies to offer discounts to some federal agencies, but frequently the VA is able to negotiate lower prices on prescription drugs on top of these federal discounts. The VA publishes a database that lists the prices it pays for most prescription drugs it purchases. However, it does not publish the lowest price it pays for some drugs due to confidentiality agreements they've made during some negotiations. Long story short, Prop 61 would prohibit state agencies from paying more for a prescription drug than the lowest price paid by the VA for the same drug after all discounts are factored in for both California state agencies and the VA, and it would apply whenever the state is the final payer. While Medicare services low-income Californians using two models, Prop 61 would only apply to one of them. Firstly, there is the fee-for-service model, which serves 25% of Medi-Cal enrollees, and second, there is the managed care system, which serves the other 75%. Prop 61 would only apply to the 25% in the fee-for-service model. Finally, the DHCS would be tasked with verifying that state agencies are paying the same or less than the lowest price paid by the VA on a drug-by-drug basis. Fiscal impact. Before estimating the fiscal ramifications of Prop 61, the legislative analyst has noted that there will be some complications that would affect implementation. 1. This measure requires that California pay no more for prescription drugs than the VA. However, some of the VA prices are not public, thus making it impossible to match or beat the price. It will be up to the courts to decide how to implement the law in these cases. Or 2, the drug companies could respond to Prop 61 by either A, raising drug prices to stay profitable, or B, simply refusing to offer VA rates to California agencies, or C, a mixture of both. In these cases, the state would be faced with a choice of only purchasing drugs that the VA does not purchase, or only the drugs that the manufacturer will offer at VA prices, or the state may be forced to disregard the law if federal law mandates certain drug purchases. So this measure could generate annual state savings, but this would be dependent upon how the previously discussed complications would be addressed and how the drug companies would respond in their pricing. The legislative analyst states that Prop 61 could save in the range of very little to significant. Lowered state prescription spending by even a few percentage points could result in tens of millions of dollars in savings. But hold that thought. Hello, beloved viewer. The Darryl Johnson Show needs your help. It takes so much time and energy to do these videos, I don't really have much left over for promotion and the like. But I would be endlessly grateful if you take a moment to post, message, tweet, email, Tumble, link, Instagram, or plus my YouTube page or any of my videos and get the word out. An informed California is a happy California, and I'd appreciate your help on that. Even liking my videos here on YouTube goes a long way. Thank you very much, and now, from Yes on Prop 61. Despite what they're telling voters, there's a reason the No on Prop 61 campaign is funded almost entirely by out-of-state drug companies. Drug companies making enormous profits from people's illness and misery isn't just a moral issue, it's life and death. More Americans die of hepatitis C than all other infectious diseases, even though there's a cure. One reason? The drug company that controls it charges more than $1,000 per pill, out of most patients' reach. And that's not the only outrageous example of drug company price gouging. The price of a common infection-fighting pill was raised overnight from $13.50 to $750, nearly a 5,000% increase. The average cost of widely used specialty drugs is estimated at $53,000. One cancer drug costs $300,000 a year. Prop 61 is fighting back against drug company price gouging and is expected to save lives. The VA prices are used because it pays on average 20 to 24% less for medication than other government agencies and up to 40% less than Medicare. Drug companies are planning to spend $100 million to fight this measure because they know it would cause downward pressure on all drug prices and cut into their excessive profits. Prop 61 is strongly supported by the 86,000-member California Nurses Association, AARP, the Urban League, the Campaign for a Healthy California, and many labor unions, Progressive Democrats of America, Bernie Sanders, former U.S. Labor Secretary Robert Reich, and many others. Join us in fighting against high drug prices and drug company greed. From No on Prop 61. Prop 61 is a deeply flawed and costly scheme that is not what it seems. Prop 61 was written and is being promoted by Michael Weinstein, the controversial president of an organization that has brought in more than $1 billion selling drugs and HMO policies. Suspiciously, he exempted his own HMO from having to comply with a measure he wrote and is promoting. He shouldn't ask Californians to approve a flawed initiative he himself isn't willing to comply with. Prop 61 doesn't apply to 88% of Californians, but it negatively impacts all Californians. More than 10 million Medi-Cal low-income patients, 20 million Californians with private healthcare insurance, and Medicare, and millions of others all excluded. This measure could result in the eliminating of VA discounts and increased drug prices for veterans. This measure is completely vague on how it would be implemented. Passage of this measure would result in more government bureaucracy, red tape, and lawsuits as state agencies struggle to implement it. All these people hate it. Okay, so this is kind of funky, but I hope I was able to explain it in a way that makes sense. Basically, it's just a law saying California government agencies shouldn't pay any more for prescription drugs than the VA. Boom, that's it. But here's where it gets weird. It only applies to less than a quarter of Californians. It doesn't contain provisions for many of the complicating factors mentioned earlier. And it all just seems a little too vague and uncertain and possibly impossible to implement. I feel like they should have done a little bit more homework before bringing this to the ballot. Furthermore, there's a trend happening here. Almost every other proposition in this election is trying to squeeze money from somewhere to pay into Medi-Cal. This is another one. I sense a black hole in the making because these Medi-Cal people are getting desperate to maintain an impossible system. Not only am I pessimistic about Prop 61's ability to function, I'm very optimistic that the drug companies will find a way around this. On a final note, you may have seen the ads on TV of military guys saying Prop 61 will hurt our veterans. And that's just based on the idea that California's implementation of Prop 61 could lead to other states doing the same thing and ultimately lead to drug companies saying, enough, no more discounts, and then the VA would have to pay up like everybody else. So maybe that could happen, who knows. If you vote yes on Prop 61, you're voting to make it illegal for California state agencies to pay more than VA prices for prescription drugs. Well, for 25% of Californians. If you vote no on Prop 61, nothing changes. The Darryl Johnson Show says, somewhat apathetically, no on Prop 61.